Hello, I'm Lavanya Kondapalli, and thank you for joining us on FITS on the Go. I'm with Dr. Howard Herrmann, one of the original partner trial investigators. Dr. Herrmann, there have been several late-breaking trials on TAVR at this conference. Please tell us what your takeaway message is from all of these.
Thank you very much, Dr. Kondapalli. It's a pleasure to be here. We had two partner trial investigations presented at the late-breaking clinical sessions here. One was the 3-year follow-up of the partner 1A trial, which was the randomized trial in high-risk patients comparing TAVR to traditional surgical valve replacement. That trial demonstrated really non-inferiority between the two devices at 1 year, which was its primary endpoint. But now we have 3-year data in follow-up, which is important in order to assess durability and whether or not these devices will continue to show equivalence to traditional surgery. And they do. That's the major finding. The outcomes at 3 years for all-cause mortality, which was the primary endpoint, as well as the combined endpoint of all-cause mortality and stroke, were absolutely identical in the 40% range at 3 years. So in that regard, it's very reassuring to see some durability data and long-term outcome of TAVR in this high-risk population that's eligible for surgery. The other trial presented at the late-breaking clinical trials by Dr. Leon was the partner 2B trial, which was a comparison of the next generation balloon expandable valve called SAPIEN XT in a randomized comparison in inoperable patients against the original SAPIEN valve. The SAPIEN XT valve is really a newer design. It has a lower profile, a different frame metal, cobalt chromium instead of stainless steel, and slightly different design characteristics relative to the leaflets. It is really the next generation valve and the one that's used in every other country of the world. And this was really the trial to see if we could get this approved in the U.S. And again, the results were quite similar for the two devices. This was a non-inferiority trial and was really identical yet again between SAPIEN XT and SAPIEN, and hopefully in the future we'll be able to get SAPIEN XT approved based on the findings of this trial. It did have, because of its smaller profile, the vascular complication rate was reduced with the new valve.